Madagali local government area, already devastated by the Boko Haram insurgency, has recently faced additional challenges due to severe flooding, leaving the residents with limited access to healthcare and essential services. In response, the Nigeria Medical Association Adamawa State chapter, with support from Governor Ahmadu Umaru Fintiri, recently launched a medical and surgical outreach to help the affected communities.
You see, the universal health coverage talks about taking healthcare services to the people where and when they need it without them facing financial hardship. And this is what the world is talking about today. And with the support of the Executive Governor of Adamawa State, the Nigeria Medical Association has been empowered to bring these health services to people at their doorsteps without them having to travel all the way to Yola, to Maiduguri, and without them paying extremely high prices for their health services. So this is what has helped, and this is what we achieved today as the Nigeria Medical Association Adamawa State.
Yes, first and foremost, I will have to appreciate the community here where we are serving today. So far, we have been received very well by the chairman and the district head and whoever is concerned. They have received us very well, and we have their cooperation fully during this exercise. So I want to extend my gratitude to them. And I also want to say that some patients that will be operated upon, will be followed up at the cottage hospital. The doctors there are ready to carry out the post-operative orders that will be given to them for those that will be operated. And for even the medical cases that have been scanned, I will urge them that any serious case will be referred back to us in Yola so that we see how we can also assist them. It's a continuous process. The exercise doesn't only end up here. So at the end, whatever decision we have taken on any patient, they should be able to be patient with us and follow the process that has been outlined for them.
Today, we are conducting a medical and surgical outreach for the indigent patients of Madagali local government here in Gulak. We have been doing this exercise for the past decades in Adamawa State, and we have never been to Gulak. Now, when we sat down and look at where we should go this year, we now realize Gulak is one of the local governments that have been detached from the center, being from the crisis of insecurities, the recent floods, the recent rise of diseases in the community, and then the high incidence of illiteracy that is usually seen associated with those complications, that we felt the best place to go is actually Madagali local government. Even though it's difficult, the terrain is difficult, you have to pass through water, you understand insecurity, but we felt if we actually want to be impactful, then Gulak is the place to go.
In this place here, what we are doing is basically the surgical site. From what we began yesterday to now, we've done at least more than 60 surgeries so far, spanning both gender, male and female, children, old and young. We've done appendectomies, herniorrhaphies, myomectomies, a lot of surgeries, and they are still ongoing. Our target is to do at least between 150 to 200 surgeries before we finish the whole program.
Operations that we've carried out here today, and we are still doing them, the patients range from the pediatric up to geriatrics. That means the young, the adults, and then the old. So all categories of people are here. That's male, female, of all ages. Then in the children, commonly the hernias in the children, and then also in the adolescents, we have operated a lot of cases of appendicitis, And also there are cases among the women, especially women of childbearing age. Most of them that have come for emergencies like emergency CS, we have taken them. And also there are cases of myomectomy that we have done. And then also cystectomies, as ovarian cysts, we have operated on them. Then for the male side, we have also the appendicitis, the hernias of different type, hydrocele. And there are cases that we are preparing them against tomorrow for prostatectomy. Yes, this is a mega outreach. Usually we do cases that are just a day case, but because of the nature of the environment, the people have suffered a lot, so we want to do all type of cases.
When His Excellency, Right Honorable Umar Ahmadu Fintiri, heard that we're going to Gulag, he was really amazed and very happy of our choice. And we were called and we were informed that all the medical bills, including logistics, our accommodations, will be taken care of. In the beginning, we were planning to do maybe 50 cases, 60 cases, based on our own finances, and maybe see 500 cases based on the drugs availability. But when the Excellency called us, we have to jack it 3 times what we can do, because we know the Excellency can afford it and the people need the services. And that's how we come about making the surgical cases 150 instead of 50, and then the outpatient, that's the medical cases, from 500 to 2,000 cases and more. This is just the minimum that we can do, but we're ready to do even more if the patients are available.
The governor deemed it fit to sponsor the 2024 Nigerian Medical Association's Physicians Week, taking place here live in Madagali, Gulag, the headquarters of Madagali local government. We've been here since Monday, especially myself. I came here as an advance party to make sure that I coordinate the accommodation of our doctors and the other health workers that came for these noble gestures. We have 3 centers for this Physicians Week. The major group of, the chunk of people are in the Cottage Hospital, where basically it was surgical operations that is taking place there. While in primary health here, Duhu, and the MDD here, this is where the medical cases are being sent. And doctors are here very busy, as you can see, seeing and consulting patients, while surgical operations are basically taking place in the Cotton Hospital. As of, we started the surgery on the 29th, on Tuesday. We had about 24 cases. Yesterday, on the 30th, in the cottage, we had major surgical operations like TAR, that is total abdominal hysterectomy. We had some intermediate cases, appendectomy, hydorrhaphy, lipoma excisions, and so many others. We had a total number of almost 85 or thereabout yesterday. If we add up to that number of the ones that was done the day before yesterday, it's quite over 100.
Wallahi shekara wajen 17 kenan nake fama, kuma rashin kuɗi ne. Na je FMC aka ce min 200,000, yasa bani da kuɗi. Yasa aka ce ana yi Fintiri yana yin na kyauta. Shi yasa kuma wannan ya min dalili na zo aka mun. Na gode sosai, Allah ya saka mishi da alheri, Allah ya kare shi da makiya, Allah ya sa ya gama mulkin shi lafiya, Allah ya ɗaga shi gaba. Na gode da abin da ya mun, na gode sosai. In ba don shi ba, bani da ƙarfi, mijina ya rasu shekara 13 yanzu. An bani da marayu kuma, shi yasa an uwana ba shi suke da shi ba su da komai. Na nema babu. To dalilin shi gashi na samu, na gode mishi. Allah ya saka mishi da alheri.
na zaga asibiti almost gaba daya Yola da private da na gwamnati gaba daya ina zagaya a ɗauka jini na a yi scanning a gwaggwada amma ba iya kama abinda yana damina, amma da taimakon gwamna Ahmadu Moru Fintiri da taimakon shi rana ta yau Allah ya yi aiki an kama abun da yake damina. Na gode maka sosai, Allah ya barka, ka taimake ni da maganin da ka bamu da wayan da ka tura. Allah ya baku, Allah ya cire maka, Allah ya baku albarka, Allah ya daɗa maka dogon rai a duniya. Allah na yau ne yau ranar ta yau ranar farin ciki ne a rayuwana. Ban taba farin ciki kamar ranar ta yau kamar yadda aka kama abun da yake damina nan ba. Na ɗauka kamar zan mutu. Shekara ya kai 4 ranar ta yau ina ta shan wahala, amma ranar ta yau sai godiya ma Allah. Allah kadai zan gode mishi. Na gode ma Allah da yadda kuma ka sake turo Ahmadu Moru Fintiri ya turo doktoci suka kama abin da yake damina. Na gode ma Allah.
My reaction to what is happening is that I have seen that people are happy with the reaction of the environment, because seeing the population of people that are here, they know that they have got some problems during the rainy season problem. So now they are sick and they want to be cured. So that's why you see the population is so very high. Really, I feel very happy because the government is trying to reach itself to the people by showing this kind of example. So this shows that the government is aware of the problem of his people. So the government is taking action to the problem of his people, and that's why now the people here today, not even today, but afterward, those that have come here to benefit from this kind of activity will go back with good news and happiness. I want to speak with a joyful voice, that I really appreciate what the governor is doing, and I want him to continue even after his tenure, either with government or without the government, or with office or without office, that he will be a man of the people, not from Adamawa even to Abuja.
I mean, I like words to describe actually what I've witnessed in the last 2 days. The summary of it is, it's awesome. The organization is superb. The dedication, the commitment on the part of the doctors, other healthcare workers, the press crew, and everybody is just excellent. And indeed, the way the patients themselves conducted themselves is really quite commendable. So it has been an awesome moment for the last 48 hours. Yes, we have seen all manner of cases here. We have seen cases of high blood pressure, that is hypertension. We have seen diabetic patients. We have seen patients with chest infection. We have seen patients with skin problem. We have seen patients with malaria, typhoid, so many diseases, both communicable and non-communicable diseases. And rightfully so, we came prepared. We came with what it takes. We were able to address most of their needs. Honestly speaking, this is one of the best partnerships I have witnessed as a medical doctor. It is a symbiotic relationship. It is a win-win situation where the doctors came with their expertise and the government provided the resources. I think this is something that is quite commendable. It should be sustained, because right now we have had more than 100 surgeries. We have seen more than 2,000 patients. For the first time in the history of this state that such a thing is happening, when you have so many patients being seen at once. So I think it is something we can use to reach out, especially to the remote areas or areas that are difficult to reach, so as to provide, you know, the best of care in terms of medical practice. Mind you, we are here with all sorts of experts. We have consultants, we have resident doctors, we have very experienced medical officers that are part of this particular crew. It is extremely difficult to find a team consisting of these experts in a rural community like this. So it is something that I think should be sustained from time to time. That can be done, because most of the people here may not afford the services in the city, or they may not afford the services of a specialist, but through this particular partnership, through this symbiotic relationship, expertise has been brought at their doorstep, their problems have been addressed. I equally believe with this current governor, who is very strategic, a very cerebral person, a man that has the heart of his, that actually truly loves his people, with the requisite political will, this can be sustained. And I believe His Excellency Right Honorable Umaru Fintiri will indeed continue to provide resources for us in order to reach out to the teeming populace in the state. He promised to do that, and as you all know, he's a talk and do person. I strongly believe it can be done. We are ready, he is ready, and I can assure you that the people will certainly get the best and the health indices will improve.
We pray for his long life. We pray for him that he will continue to be in administration even to the villa. Yes, because he is equal to the task. He's a man of integrity, man of sympathy. He considers his people. He has sympathy for everybody.
By addressing the urgent medical and surgical needs of these vulnerable populations, the Nigerian Medical Association and the state government are contributing to the recovery of the region and the overall well-being of the residents.